watch gently over those who sleep. I think that's such a powerful statement about what an anesthesiologist does.
It was coined during the Second World War by Dr. Wesley Bourne during the initial years that the Canadian Anesthesiologists Society got founded. He was a profound lover of Greek mythology. So he found the Greek phrase "kadavontas paradrumen," which translated means we watch gently over those who sleep. And I can really say over the years that many patients' fears have been allayed by removing the technical part of the discussion of what we're going to do to them and focus on the fact that we truly care, we're compassionate and empathetic about their problems and their health issue, and that we're going to be by them through the course of their anesthetic and surgical care.
You might start to feel a bit funny as we give you this medication, okay?
While most people are familiar with the comforting voice of an anesthesiologist during a surgical procedure, their role extends beyond the operating room. An anesthesiologist is responsible for preoperative assessment of the patient and, in many instances, looks after the patient post-operatively. They are also often involved in pain management, both acute and chronic pain. Prior to surgery, the patient and anesthesiologist will meet to review the patient's medical history in full detail. The anesthesiologist will ensure the patient is in optimal condition for the surgery, provide information about what to do on the day of the surgery, and answer any questions the patient may have.
We're just going to go through your medical history. It's very important for me to get a thorough medical history just to make sure I'm abreast of all your health issues so we can give you a nice safe anesthetic for your proposed surgery today. So today you are having a bowel operation. They're doing a laparoscopic right hemicolectomy, taking out part of the bowel. And Dr. Chris Andrew is your surgeon, is that correct?
That's right.
Okay.
Often, a patient who needs surgery actually has a number of complicated issues going on. These patients require special attention by the anesthesiologist.
For instance, a good example would be someone who's a heavy smoker. They might have some bad lung disease, they might be having trouble getting around because their smoking is so bad, or they've been smoking so long that their lung disease is so bad, and they have to come for surgery on their lungs. Well, that might be quite challenging to do if we can't use both their lungs during the surgery, as one of them is being operated on. So those are the kind of cases that I enjoy doing, and I find mentally challenging as well as, again, technically challenging.
Anesthesia residency is a 5-year program an individual will require after medical school.
So we rotate through all kinds of different specialties, and then at the end of that first year, we're sort of general doctors, and then after that, we start to focus more on anesthesiology, and then the anesthesiology subspecialties like pediatric anesthesiology, cardiac, pain medicine, neuroanesthesia. And then as time goes on, some of us decide that we would like to further subspecialize, so that's some additional time on top of the 5-year residency program.
Anesthesiologists may choose to subspecialize in areas such as cardiac, pain medicine, neuroanesthesia, and pediatrics. Clinicians who work with children must ensure the patients and their families are comfortable with the upcoming procedure.
Kids are not small adults, as we all say. So the approach to anesthesia in children is to deal with the child, his illness, his developmental level, and to try and make this whole experience tolerable for a small or older child and their family, so that they can all manage to get through this experience. I think that's one of our biggest roles, is to try and make this experience tolerable for the whole family.
The anesthesiologists we spoke to share a common goal: to work collaboratively with other members of the healthcare team and to provide the very best care for their patients.
I enjoy taking care of sick patients. It's part of the reason why I do critical care, and it's part of the reason why I like anesthesia.
I think it's part of being inclusive of a healthcare team and working in a collaborative environment, but also being truly respectful of patients and the conditions and the health challenges that they face. Being able to comfort them and allay their anxieties and fears is a big part of that, and we have to show tremendous respect for the deep emotional and physical health challenges that they're facing.